Welcome to Public Health Matters, where we talk about matters of public health. I'm Bobbie Bagley, Chief Public Health Official and Director for the City of Nashua's Division of Public Health and Community Services. And I am very glad to have with me today Myra Nikitas, who is a public health dental hygienist, who's going to talk with us about the importance of dental hygiene and a special program that she's working on. Welcome.
Thank you so much, Bobbie. I'm so excited to be here today, not only to see you, but to talk about this new dental prevention program that's coming to the Nashua School District. So thank you.
That sounds so exciting. And so I know that you've done some work with the Dental Connection and with the school in the past. So let's talk a little bit about that. And I first want to you look very different today.
Thank you.
Because the last time I saw you, you were the dental fairy.
Yes.
And you were at Greeley Park. So let's talk a little bit about what you were doing at Greeley Park and why were you the dental fairy and why was it so important for parents and kids to see you that day?
Sure. So thank you again. So I left my wings at home today, I'll be honest. They're still drying off from all the rain we've been having. So, you know, my passion in life, and especially being a dental hygienist, is promoting the importance of dental care and dental hygiene. A lot of parents and kids just don't understand the impact that that can have for their future. A toothache is not fun, so anything I can do to help them prevent that is my long-term goal. So that day when you saw me in the park was an event for kids. I was dressed up as the tooth fairy to try to promote dental hygiene, dental health, and passing out toothbrushes. So
nice.
I've been very passionate through my career in advocating especially for kids. So I'm excited to talk to you about this program. I've been involved in public health for the past 7 years. I've been a hygienist for about 20 years. So my passion is to help and advocate, especially for kids, because unfortunately that's the #1 reason why a child would miss school. It's 10 times more prevalent to have a toothache or a tooth problem than it is having asthma. So that's a continuous problem, Bobbie, that we need to, as public health professionals, help mitigate that for our future of our youth.
And that's so important. I'm glad that you talked about the seriousness of the toothache and the missing of school. We have had the opportunity in Nashua with having different programs in the schools. And they actually used to do the dental cleanings, or they used to have, I think it was a short-lived program, probably for, was it about 3 years that they were doing this in the schools? And are they still doing it now? It was with the Dental Connection.
So unfortunately, the Dental Connection brings the kids, not unfortunately, but they bring the kids to the clinic. With COVID in the past few years, there's been a huge decline in this and the receptibility to that. So this program, sponsored by the Department of Health and Human Services in collaboration with Solvair Health, is going to be offering a school-based program in the schools, in the Nashua School District. So I will be the clinician providing the care. The school prevention program is going to be called Sealing Smiles Across New Hampshire.
Oh, sealing or sealant?
Sealing Smiles.
Sealing Smiles Across New
Yes,
Hampshire.
providing,
that sounds amazing.
dental care for Granite State kids. So this is a huge program sponsored by the Oral Health Division of the Department of Health and Human Services and by Solvair Health. So I wanted to give you a little background information on Solvair Health as well.
Okay.
So Solvair Health is a innovative company. They provide health care through a sustainable solution that is helping to resolve some of these areas where the care is not there.
Okay.
They have partnered with the Department of Health and myself to provide this care to especially kids, knowing that there is such a need.
So in the role that you're going to play now, because we have 17 different schools, and so will this be at the grammar school level? Will it be at middle school? Will it be at high school? What is the age that we actually really want to target? And I think the earlier we can do this with kids, the better. So it's going to be with the grammar school kids?
Sure, yes. So the goal is to provide this dental care within the schools to all elementary schools
Okay, the
and middle
elementary.
schools, so kindergarten through 8th grade.
Oh, great.
At this point. So trying to get these kids early on to really make them understand that there is, an importance. The mouth is connected to the body, right?
It is, and that's a part of
Huge.
health, period. I know we tend to do this thing where we separate the mind from the mouth and the full body,
Right.
but it's all a part of the full body, right?
Exactly.
And so we have to look at dental care as a part of the holistic care of the entire body, because the dental care can affect the heart, it can affect so many other areas and so many other systems in the body as well. So with this program, how is it being introduced to the schools? Is there information that's going to be sent out to the parents through the school district? Tell us a little bit about that communication.
First off, I have to give credit where credit is due, because the Nashua School District was overwhelmingly open to this dental initiative, knowing that the care is needed within our youth. So I have to say that they've been amazing in helping us kind of get this program up and running, really. We've been working on this since early summer, and it's been amazing to be able to provide this initiative and knowing that we have such amazing support. So I'm talking, nurses, superintendent's office, the communications director, other staff, support staff within the schools. So all that paperwork will be available on the district's website.
Okay.
There will be an icon that you can click onto and see all the materials there. We've kind of narrowed it down to the 5 most commonly spoken languages within our community. So you'll find the information and the materials translated, the documents needed, to be able to participate in the program as well.
That's awesome. That's awesome. And I'm glad that that was something that was thought of in the pre-planning and not as an afterthought.
Yes, because
right?
it's so important. These are huge roadblocks that, we come to, and knowing what we know, if we can prevent that and make this go as seemingly smoothly as possible,
Right.
that's what we want to do.
Yeah.
And we want to be able to give these kids the care,
Right,
because
right.
it's so important
Right.
that
and
they
it makes
understand.
it equitable for all the kids, right? So there won't be, as you said, any gaps or families that won't have the information. So that is
exactly.
awesome.
And Bobbie, this is no cost to the families. So, with the grace of the Department of Health and Human Services and the Oral Health Program sponsoring this, and Solvair Health, this program has been made possible to the Nashua schools families and within the community. Unfortunately, there was data that was collected a few years ago, and Nashua was ranked the highest in dental caries throughout the whole state.
I did hear that. Yeah.
So, to me, this is my home. This is where I have a foundation. I live here in Nashua. My son goes to school here. That was heart-wrenching for me. And I knew at that point we need to do something more. And these people that are involved in this project have amazingly, dedicated time and effort to make sure that all this material is accessible to the
Right.
families to understand the need, especially with the Nashua School District as well, working very closely with the ELL coordinators within the district, being able to provide this material. So you can see that this is going to be a huge impact in a positive way
Right,
throughout
right.
the community.
Yes, this is going to be amazing. I remember when I first started working in public health, probably about 20 some odd years ago, the issue with dental caries and cavities was a problem in Nashua at that time. We had dentists in the area that voluntarily saw certain families, if they didn't have commercial insurance, they would take the Medicaid insured clients, and we just worked really hard to do all that we could to make dental care accessible. And so this program sounds like this is going to be another one that's going to fill in a gap, where there were
Absolutely.
challenges or there were some
And
barriers.
Bobbie, here's the thing, we're meeting the kids where they're at.
Yes.
So, I will tell you a personal story. When I was a kid, my parents worked 7 days a week, 12-hour days. My dental care was provided through a school-based program.
Nice.
So that's why I know I'm, the evidence to say that it works. This is hugely impactful for the community, and I'm hopeful that parents are aware that There's no cost to them. There's no drilling. There's no pain. There's no shots. There's no aerosols to, you know, in the air to, you know, that are going to make this project even better.
So the risk will be low. So what do parents need to know? So walk me through what would happen. And so I'm going to get some information. I'm
Yes.
going to click on that link. It's going to have information about the importance of the program. And then what do I do? Do I sign up? Is there something that the parents will be given like a release so that their child can come down? Is there an opt-out? So what does it look like for the parents? Because they don't have to be at the school in order for their child to have these services, do they?
Exactly, no. So we're going to be working at kind of school to school. We're going to be going to all the elementary schools. So when we are going to be going to your child's school, the paperwork will be sent home. If your child loses the paperwork, flies out of their backpack, that paperwork is going to be still accessible on the district's website and the school that they attend's website as well. You can download the form, consent to the treatment. There's the HIPAA form as well, so you're aware of the information that's shared and not shared with your permission. And there's a flyer that goes along with that consent form to kind of talk about the program.
Nice.
So if your child, you know, submits that consent form, when we're visiting that school, they will consent to treatment. We'll be able to provide this advanced preventative treatment. Every child does need a consent form. So my email is available, my phone number. You know, if there's parents that have questions, they feel free to email me. I'm very personable, very passionate about, you know, helping the community. So I'm very personal. If you catch me in the grocery store, talk to me, ask me questions. I'm more than happy to share any information or how, you know, we can make this easier for your child to get care.
Yeah. So Myra, will there be a schedule online? And so all this information will be on the school district's website. And so, like I said, we have a number of schools, so it's going to be at the elementary and the middle schools. Will there be a schedule? And so will, for instance, they're at, I'm trying to think of a school, Elm Street. So for instance, at Elm Street, will there be a schedule of when during the calendar year you'll be at Elm Street, and will it flow that way? What does the schedule look like?
Yes, so once we kind of launch the program in October, we'll have a better knowledge of what schools we're going to be targeting first, and kind of give everybody a heads up. So we're still trying to
so those things are still being worked out as far as the schedule
Yes,
and
but
all.
as soon as we know, everything will be readily available. We're going to have a Facebook page, an Instagram page as well, so you can follow, make comments, ask questions, you know, through there. So keep your eyes open for the information. You know,
and there'll be lots of ways that we at the Division of Public Health and Community Services will help be able to promote this as well.
Thank
so
you.
we'll put this in the newsletter.
Wonderful.
We will make sure that we have you back here again throughout the year, because the program will run year round. Is that correct?
Yes, it's for the 2023-2024 school year. So we've got a lot of ground to cover, and we're so excited and really thankful. And I'm so happy and proud to be working for Solvair Health, because they make patient care priority, knowing that this is such a need, you know, for our kids. When they say it takes a village, it really does take a village, and we're so glad to have, you know, the support from every direction, from the state, from Solvair Health, from the Nashua School District, especially to Dr. Andrade was very supportive of the program, and as well as the principals and nurses, and you know, in your department. So we're so thankful. This is going to have a huge impact, and I can't wait, you know, to talk more about it. So
now, what role will the school nurses play? So they will get the consent forms from the parents, and then the students will just, in the time that you're there, will it be a block hour of time? So what if my child doesn't make a date that you guys are there? You will be coming back?
Yes, so we'll make sure. We don't want a child to miss lunch. We don't want a child to miss, you know, a special that they're looking forward to throughout the day. So we're going to take that all into consideration. We're going to be setting up where we can in the schools. So I don't know what that looks like, but you know, we're not
there'll be
picky.
opportunities, so a child may not miss their opportunity if they're absent because they're sick, or like you said, you know, not missing something else in order to do this, there'll be opportunities for them to take advantage of this.
Absolutely. And the care that we're going to be providing, Bobbie, you know, we go by and we make sure that they ensure the health and wellness of the community and kids and staff. That's a huge priority for us. So following CDC guidelines and infection control is, you know, amongst one of our top things. So again, no aerosols, no drilling. I think patient compliance will be, you know, a lot better. This is their familiar place as well. So if they have a para or a teacher that they feel comfortable coming into, you know, our little setup area, that's okay. You know, we want to make this as friendly as possible for every child to receive this care because it's important. This is going to, what we do today is going to impact them, you know, tomorrow and help them not miss school. So these appointments will probably take an average of 15, 20 minutes.
And then talk a little bit about how this protects the teeth, right? And so in this program, and then what else are parents going to be learning? Because it's one thing to have, you know, this opportunity, but then there are other things that parents also need to know to help maintain the, you know, the teeth, and then also take some more preventative measures as well. So what else will be included in the program?
So we're going to be providing advanced preventative dentistry. So what that means is providing silver diamine fluoride. Silver diamine fluoride actually stops a cavity progression in the mouth. So that, accompanied with a sealant glass ionomer material, is going to kind of be like a shell over the tooth to protect the tooth. Glass ionomer material is a bacteriostatic material, so it kind of prevents any growth of any additional bacteria. So this is all done on the back teeth to prevent, you know, any areas of decay. Unfortunately, you know, there's a misunderstanding. A lot of times, you know, I have a parent will say to me, oh, it's just a baby tooth that's going to fall out. Unfortunately, that baby tooth kind of holds the spot for a permanent tooth to erupt. So we want to make sure that we're taking every precaution in keeping these teeth healthy and all that we can and do to mitigate, you know, additional cavities. So it will be a silver diamine fluoride application to stop the progression of cavities in the back teeth. Glass ionomer material will be placed as a kind of like a shell on that tooth to protect that tooth. And a fluoride varnish, which is, you know, helps kind of strengthen the teeth and strengthen all the dentition forming and such. So
now, does this application have to be done more than once a year?
Well, we'll kind of take it as it comes. I mean, if the decay is pretty deep, then yes, it may need to be reapplied. If it's pretty superficial, then, you know, maybe not so much. So, you know, we'll kind of see. We're hopeful that this material will kind of strengthen the tooth all in all, so that it may need or may not need additional care.
Yeah. And then will there be other information that's provided, Myra, for parents for further prevention of tooth decay? So one of the things that I did learn, so we have a new program that we're going to be implementing, which I think will also be complementary to this, which is My Smiles Buddies. And with this program, parents are going to be educated, made aware of how cavities can start. And some of them can simply start from cavities in adult mouths, and then adults sharing their food, having the child, you know, taste, you know, some of the food that they've eaten after they've put it in their mouth, and then applying it, because it's the bacteria. So you're transferring bacteria from one mouth to another mouth. And so this program that our community health workers will be doing in the community will be teaching parents about that preventative effort around the spread of the bacteria. And then with the application of the sealant on the teeth will help protect the teeth. But then there's other knowledge or other information that parents will need to have, as well as how do we further prevent. And so will there be other educational information distributed to the parents with regards to not drinking lots of soda, making sure that you brush, how often do you brush, how long do you keep your toothbrush? So will those also be other informational things that will be shared with the parents as well as a part of this program?
Absolutely. So initially the child will have a dental assessment, oral assessment,
Okay.
and then we'll kind of go through some oral hygiene instruction. Every child will go home with, the tools that they need to continue good, healthy,
Nice.
habits at home, brushing their teeth, flossing, and, toothpaste.
Oh, flossing. Oh, that's another one that's so
Very
important, right?
Yes.
Sometimes we don't think that that's
That's
important,
right.
but flossing
Absolutely.
every night
Yeah.
or every day, whenever you can do it, is really, really important.
And so prevention is key, Bobbie,
Yes.
right? We know that. So providing these services, in addition to the others that I mentioned, if the child, needs this other care, that will be provided in the school. So that's huge. I mean, a report will go home to every child stating that,
Nice.
what services were completed that day, the recommendations, for continued care. We recommend that the child have a dental exam at least twice a year. This doesn't take the place of a dental exam.
That's really key, Myra. I'm glad that you said that.
Yes.
So can you say that one more time? So
Yes.
this does not
This
take the
does
place.
not take the place of a dental exam.
Right.
Every child still needs a dental exam with their family dentist. If the family doesn't have one can be recommended to them. Just depends if they have insurance, no insurance, Medicaid, whatever the situation, we can help kind of be that liaison for them to kind of connect with a provider to continue care, which
This
is
is so
very important.
Yes, this is so important. I used to do home visiting early on when I first started at the health department, and this was one of the issues that we always talked about, especially, and we started having the conversation about the gums and protecting the gums and the teeth early on. So this is really good information. It's a program that I really believe is going to benefit our community because it's unfortunate that Nashua's, what did you say? We were number one?
Number one.
We have the highest number
dental
of
caries.
dental caries
Yes.
in our grade school children.
Yes.
So this is going to be something that's going to really help reduce those numbers and
Yeah.
help increase the prevention efforts in the schools through this program for our elementary and middle school children.
Right. Access them, get these kids where they're at. And parents may not be able to take the time off of work.
Right.
So at least, this is kind of giving them that opportunity for their child to have some dental preventative services. So I encourage
what
that.
other things, Myra, are going to be done to help warm up families and children? Because going to the dentist, or even when I think about things with the teeth, you have to kind of get folks prepared for that, right?
Yes,
And
yes.
so, because there's a fear. There's a fear of going to the dentist, but we want that to be a part of every family's general overall thinking about their health care, right? So we
Yes.
do the physical exams annually. There are things that we do, on a regular basis for our preventative health. And so how do we ease the families into this whole thing around the teeth and the hygiene and the sealants and the programs? Because I think this will also help set families up for that gentle entry into the dentist's office as well, because they would have had
Absolutely.
exposure to you.
Right. I mean, come on. I'm as friendly as they get,
Yes.
right? So trying to give them that ease and confidence that it's okay, nothing to be afraid of.
Right.
These, applications are non-invasive, so it's just providing the kids with that information that, hey, it's okay. We have lots of tools and tricks that we're going to be bringing with us. We have our friends, our stuffed animals,
Nice.
our giant teeth models, to kind of encourage and talk about these kids about, their role in prevention. So it's kind of like a partnership,
Yes.
right? So, the dental professional and the child kind of have that partnership that they're going to do their part at home and brush their teeth and do the best they can, so that when they're coming in for their exam or cleaning or other preventative services, that, it's a team effort. So,
Right, yeah. Now, what kinds of things will they get? So, for instance, when you go to the dentist, I'm really surprised that they do this at the dentist sometimes. They'll give a lollipop. So it just got
I know, right? Hopefully.
I'm like, okay. So
Yeah.
maybe is that the thing to get me to come back here? Because
I know, right? Yes.
Or because there's little incentives that are given. And so will
Yes.
this program, will there be incentives that are given to the children and the youth, the elementary children, and then the middle schoolers? I don't know if they like to be called children or not, but they are. And then what things are they taking home to their parents?
So they're going to be taking home a goodie bag, which will include a toothbrush, toothpaste, floss, anything that's going to help them continue good hygiene at home, oral hygiene at home.
Okay.
They also get a report from, the events of that day and procedures that were done. So just to kind of, I think encouraging them that they can do this. They can do this at home. They can show their other brothers and sisters or siblings or parents, guardians that, hey, I can brush my teeth. A lot of times when I dress up as the tooth fairy, Bobbie, I always say to the kids, if my mouth isn't healthy, is the rest of my body going to be healthy? Is my belly going to be healthy? So they kind of understand that everything's kind of connected. And to have a chronic infection or a toothache, it is not good.
It's not fun.
It's not
good.
fair, and it's not fun. So if we could prevent at least, a handful of kids from having to experience that, then you know what? Pat on the back. We've done good.
Yeah.
The key is prevention. This will kind of pave the way for their future, understanding that, it's important to keep our bodies healthy. For longevity, right?
Yes. And tell me again, what is the program called? Sealing
Smiles Across New Hampshire.
Sealing Smiles Across New Hampshire.
Yep, bringing cavity prevention to Granite State kids.
Wow, that's going to be nice. And so again, what else are we going to do to kind of like push this out? So we are so glad that you're here today to share this, but what else can we do? What can we do at public health to help push this out? Because again, October, we're going to spotlight October
yes.
As Dental Health Month or Oral Health Month, however they have it framed for this year. And then all throughout this month, we're going to be talking about this.
Yes, we're going to try to promote this as much as we can. Listen to maybe the communications director for the superintendent's office. We'll be doing some phone calls, emails, newsletter. So look out, keep your eyes peeled to sign up, your child for this program and consent to treatment. So this is going to be
It's going to be awesome.
Amazing.
Now, Myra, how can people get in contact with you if they want more information? Because after people watch this show, we are really helping. Again, because public health matters.
Thank you.
And this is one of the matters of public
Bobbie.
health.
Thank you.
How will people be able to get in contact with you if they want more information to get prepared for October?
Feel free to call. My number will be up on the screen, or email me for sure, and I'll get back to them to provide more information if there's any questions or anything I can do to help this process easier for the parent or child.
Awesome. So Sealing Smiles Across New Hampshire.
Yes.
That's going to be amazing.
Yes.
And coming here to Nashua School District first.
Yes.
Are we going to be the first school district?
This is the first.
Going to be it. This is awesome.
So excited, and I'm so thankful.
Awesome.
Yes.
Thank you so much. I'm so glad to have had you today as one of our guests.
Thank you, Bobbie.
On the Public Health Matters. And what we are looking forward to is more information to be coming out during the month of October. So as you go on for the rest of your day today, make a good day today and have a healthier day tomorrow. Thank you for joining us on the Public Health Matters. Until next time.
When you lick spoons and pacifiers, you share bacteria that causes tooth decay in your child's mouth.
Go, go, go!
This assault is 100% preventable. Brush and floss twice a day to keep the cavities away. Moms, it's up to you.
Healthy habits for a healthy smile.